Good morning, Chandler. I am Chandler City Councilmember Jeremy McClymonds, and the international spread of COVID-19 has created a lot of uncertainty and fear across the United States. And I wanted to take some time today and talk with Chandler's Fire Chief, Tom Dwiggins, to share some facts and information on how our first responders are preparing and adapting to this pandemic. And welcome, Chief Dwiggins. How you doing, sir?
I'm doing great. Good morning.
Morning. So one of the questions I have is, how are the firefighters doing?
Well, first of all, thank you for asking that. They're doing very well, considering the fact that we're currently in a global pandemic. I want to say that we had a pretty good jump on this. Our emergency operations team, our emergency management teams really started preparing for our response and really how we were going to alter our operations when we started to see the virus actually come to the city of Chandler. And so a lot of that preparation, a lot of the things that we've put in place has really helped, I think, ease some of our firefighters' minds. Clearly, it's still a dangerous job. And clearly our firefighters are out on the front lines every day, day in and night, and they're providing the highest level of service. To be honest, I couldn't be more proud of them right now. The service that they're delivering has been outstanding. All of our firefighters are fathers, they're mothers, they have children, they have husbands, wives. And so some of the same things that we as Chandler citizens go through, whether it's the fear of contracting this virus, whether it's the supply chain issue of getting things we need for our homes, whether it's even the simple things like grocery shopping, the fear of exposing our family members, all of those things are very prevalent in the minds of our firefighters. Yet they get up every morning, they put their uniform on, they go to work, and you wouldn't know it. They continue to serve our public, they continue to serve our community. As I said, they do a phenomenal job, and really in a time of what I'll call chaos within our community, they've been solid as a rock, and they really lead us by example on how we should behave and how we should hold ourselves, and really that is we remain calm and we serve others, and they've done a great job on that. So I'm very proud of them, and I appreciate you asking.
Well, I'll tell you, it definitely takes a special breed and caliber of person to do what you guys do on a daily basis. And I know you touched on it a little bit, but how has your operations changed during the pandemic? What exactly are you doing different?
So that's a great question. Obviously, any type of virus, it's a hidden virus. It's something that you can't see, and so you really have to change the way you conduct your operations. Every one of our 11 fire stations, all of our fire engines, our ladder trucks have paramedics and EMTs on them. And so the majority of the calls that we respond on are medical calls. In fact, we're up to almost 75% that are medical calls. Right now, we're in a state where, because this virus is widespread throughout the state and specifically our county, is that when we interact with the public, specifically on emergency medical calls, we really have to just consider that everybody potentially has this virus. And so we have changed our operations. Couple of things specifically that we've done. You call 911 and you have a fever, or you have difficulty breathing, some of the characteristics or signs and symptoms of COVID-19. There's a chance that as we're responding to your house, to your business, wherever you are, that we're going to call ahead of time. We're going to get some information during our response. We may ask you to come outside. And really, that's just to limit the amount of exposure that our firefighters get, or that we potentially could give you by going to an open environment. And so you'll see when we get on scene, we try to, for the most part, stay in groups of 4, but there are certain types of incidents that we're going to respond to that you may only see 2 of us. And again, that is a goal of ours to limit exposure. A lot of people think that a lot of the things that we're doing are changes in operations is about our safety, and that's true. But it's also about the safety of our citizens. We want to make sure that we're not potentially exposing them. I can tell you, our firefighters, they come to work every morning, and the first thing that they do is they have their temperature checked. The captain assesses them to make sure that they're not coughing, that they don't have any cold, or none of the symptoms that we see. So when we first get to work, we ensure that the firefighters are all fit for duty and that they don't have any types of symptoms of the virus. And then when we're on the calls or on the incidents, we have different treatment protocols that we put in place. We have an outstanding partnership with the hospital, and we're working with the physicians in the ER department every single day to look at the treatment protocols that we're implementing and really trying to understand if there's any best practices out there, things that we can do differently. But we have instituted all of those things. We've had a lot of success with that, and it's something that obviously we're going to continue to do. Our operations, they've changed, and we're probably going to stick with those for a while. I know that right now there's a lot of discussion on reopening the economy, reopening the cities, the states, and those are all great discussions. I think one thing you'll see with some healthcare providers, including our EMTs and paramedics, is that we'll probably continue to do a lot of the protocols that we're doing right now, the changes in operations, until they find a vaccine for this virus, or at some point there's herd immunity where we know enough people have been exposed so that we're not worried about it actually moving the virus throughout our population. So we've done a lot of things. Those are on calls in the fire stations. A lot of people don't know this, but we don't wear our shoes in the stations anymore. We don't wear our boots. We make sure that we're just doing all the things that we can do to ensure that everything is clean. And then it's just a constant assessment of each other. Our firefighters are still, a lot of what we do when we're not responding to calls, probably the most important thing that we do is train for calls. We've had to shut down our training division, and that's just because we have to limit the number of people that can train together. So we've done a lot of online training, and I know that our firefighters, they're getting phone calls. We do a WebEx phone call every day at 1 o'clock, and we are updating them on what is going on within the community. And then we are also updating them on how they can better serve our community. And so it's an active process of looking at our operations, at changing our operations, and then measuring the success of the changes that we've made.
So, I mean, you've touched on most of it, and we've been receiving a lot of questions from citizens on how we're protecting first responders before, during, and you've touched on that. But can you just go into a little bit of detail on what you're doing after they've went through a call?
Sure. So to your question, early in the morning when they get there, that first temperature check and assessment is one way that we protect our firefighters, because we certainly don't want someone sick on the fire truck that could pass this along, and we don't want somebody sick in the fire station that could pass it to the other firefighters. But then as we're responding, and this may look a little bit different, when we respond to calls now, we are wearing the N95 mask that everyone talks about. We're wearing goggles. Depending on the call type, we're wearing full gowns. We're always wearing gloves. So we're trying to make sure that that we are not exposed anywhere, that really none of our skin is exposed. And the gown is so that if we have to get close to a patient, if we have to assess them and they're coughing and we get droplets on us, that's something that we can just throw away and move on to the next call. So that's, we have the PPE, and I can tell you that Chandler's been very lucky. Early on, we had a good stockpile of PPE. And we've made sure that we made it last, but we've also had some community partners that have helped us out, the hospital, AMR ambulance, who really were able to give us additional supplies to make sure that our firefighters are safe.
And so for everybody that might not be aware, PPE stands for?
personal protective equipment.
Gotcha.
That's your gloves, that's your mask, that's your goggles. Really the thing that you're hearing about in the news every night that there's a shortage of, that we've been really blessed to have. So, we have enough PPE, we make sure that our firefighters are safe, that they're healthy, but then there's a lot of cleaning going on. So we have to decontaminate all of our equipment after every call. So you may see us go to a residence where we are treating a patient, and then we come out, and there could be an additional 10 minutes of us wiping down all of our equipment, making sure that our gloves, that our gown, everything is disposed of properly. And then when we get back to the station, we have to wipe down the truck, the inside of the fire truck, anywhere that we had stepped, anything that we had touched, we need to make sure that that is clean. Additionally, when we actually transport a patient in the ambulance, we will drop the patient off at the hospital. And then once the hospital is transferred over to the physician or the RN on staff, then we decon the ambulance. Decon means decontaminate. And that's a long process, but it's really important, and it's really, it's part of our operations plan that we make sure that after every incident, everything is clean, everything is maintained, and that we are ready to go to the next incident without fear of exposing the next patient to, potentially the virus.
So from the onset of the virus, you have been briefing mayor and council on emergency call volumes. It's one of the data points we've been looking at that's leading our decisions. And in recent briefings, you've explained how the emergency call volumes went down. What does that mean for how this is affecting our ability to respond to COVID-19?
So we did notice, we started tracking our call volume early on when the virus, I believe it was when the first case hit here in Arizona. We really started to look at our data to try to understand, how many types of calls we were responding to that had signs and symptoms of a fever or difficulty breathing. But we were also looking at our overall call volume. I can tell you that when the order came out for people to stay home, and the governor essentially closed most of the businesses, it wasn't a day after that we noticed a significant decrease in our call volume. We started to track that, and over a 2-week period, we saw almost a 35 to 40% decline in call volume. Now, we attribute that obviously to some type of social change that's occurred within our community. And for us, we believe it's the social distancing. It's the people staying at home, which really is a testament to the city of Chandler, our citizens. This is a virus, and although the mortality rate's low, there is a vulnerable population out there this really impacts. And so it was really important for our community to come together to help flatten that curve. And I think that that call volume that we saw, that decrease in call volume, really was an indicator to us that there was a social change that had occurred within our community. And like I said, it was definitely that people were staying in place, they were staying home, they were really just not doing the non-essential things that they used to do. Now, how does that help us? Well, it helps us in 2 ways. First of all, we were putting operational plans in place on what we were going to do if this virus hit at a magnitude that maybe you see on the East Coast. How would we respond? And honestly, it was a tough planning process, just because of the amount of people are doing the right thing, and because we've had a 35 to 40% decrease in our call volume, we now have the capacity that if we do get a spike with this virus, that we're going to be able to respond as we would if the virus wasn't here. So it's really helped us to open up our capacity and to give us more time within our system to respond to a greater number of calls. Additionally, when you cut out 40% of your call volume, you also cut out 40% of your PPE usage. So our PPE usage that we were utilizing on, let's say, cardiac calls or trauma calls, car accidents, we're just not using those anymore. We still have calls, but just not at the level that we used to. So we've seen what we're calling our burn rate, which is how much equipment that we use per day, decrease dramatically just because of the the shortage of call volume that we're seeing within our system. So it's really been good for us, and it's good timing for us that this occurred, and it really has put the fire department, it's positioned us well so that if this peak does come, that we will be well prepared to serve our citizens just like we're doing today.
Okay, well, I'll leave you with this last question. So you had alluded to it, and in fact, next week on Mayor and Council, we're meeting to discuss what the city manager and city staff has prepared as a plan for what's the next step as we step back out in society, and what does that look like from the city, the community on out. So when we get the green light, we're ready to go. But in that regard, how are you working with county and state departments and local hospitals to ensure we're prepared for the next step?
So we've been working with the state Arizona Department of Health Services. We've been working with the Maricopa County Department of Health. We've been, obviously dialed in to the CDC from the very onset of this virus coming into the United States, and then, at one point coming here to Arizona. I can tell you that our team here in the fire department, our team here within the city, we stood up our emergency operations center early in March, and we have attended just about every meeting, WebEx, phone conference that you can think of. And that has occurred every single day since, I would say, that probably second or third of March, where we have a representative from the city of Chandler who is attending these meetings, who is calling in and asking questions, trying to understand guidelines, trying to understand what the best practices are in keeping our community safe. It is something that is you could literally do this 24/7, and we have people assigned here in our building where the EOC's housed. Their only job from the time that they come to work till the time that they leave is to try to find new information about the virus, the response to the virus, how we should reopen the city, and present it to our EOC staff. And so we work with these groups every day. We share data with them. We obviously get their data, and really, they've served us very well in creating guidelines for us to follow, not only in the field delivering patient care, but how we do our planning for what's happening right now, all the way to what's happening in December. We are right now looking at operations in December and asking ourselves, how will this virus impact it? And if we had to go that far out, what would we have to do? Now, I hope we don't have to go that far, but we want to make sure that the city of Chandler is prepared regardless of what is thrown at us, that this city will continue to deliver the highest level of service across the board, not just in public safety, but in every aspect of the city. And then, of course, we want to do our part in making sure that we're healthy and that we can open up these businesses as soon as we can.
Thank you, Chief Dwiggins. I really appreciate you taking time out of your busy schedule to update me, talk with me and our citizens, to inform us on what the fire department's doing to keep us safe. I appreciate your time today. No problem. And more importantly, for everybody out there, the Chandler Fire Department's got great social channels. Follow their channels and follow the city channels, all social media, Facebook, our website. There's going to be a ton of information that we're going to be disseminating in the next couple of weeks as we hopefully step back out there to go to the next step, to opening up and getting closer to a normal world that we're all accustomed to. But as a council member and your neighbor, I'll continue to be here to support all of us as we navigate these extraordinary times. And I'll remain a strong advocate for our entire community as we plan for the future. Thank you, Chief, again, and thank you for watching today.